Thanks for that tip, Rena.
All right, and I am going to stop sharing my video because no one needs to see me, and I'm going to hit start. Ready?
Good evening, everyone. My name's Brina Holmes. I'm a pediatrician and faculty up at Vermont Child Health Improvement Program. We're thrilled to have Monica Benjamin here tonight to talk about pediatric vaccines and answer your questions. We're going to wait a few minutes so people can log on and join. And while we're doing that, we'll be quiet, but we are here and we're getting ready. Happy to have you. Okay, everyone. Well, I think we have a few people who have joined, and we're going to go ahead and respect everyone's time by starting 7:03. I have the great pleasure of introducing Monica Benjamin. She is right here in Addison County, local nurse practitioner, works at Porter Pediatrics. She's been a great champion for our children and families in your community, and she's going to do some slides, get some information out, and then we're going to spend some time answering your questions. So take it away, Monica. Welcome.
Thanks, Brina, and thank you everybody who came this evening. So we're going to talk about protecting our young Vermonters with COVID vaccines. So I will go through the slides and then we'll have a question and answer session at the end. So we get some common questions from families when we do these forums and just in general in talking to families about the COVID vaccines. Does my child need to get vaccinated? What are we actually protecting our children from? And what are the risks of the vaccination? So we're going to go through some of these as we advance on in the slides. So the COVID vaccine is very similar to other vaccines you received there. I think there's been a lot of press around the mRNA, and this is the first mRNA vaccine that we've seen. But the things that cause COVID, such as the SARS-CoV-2 virus, can come into our body and invade and multiply. And so the vaccine helps to stop this from multiplying by helping the immune system make some special proteins called antibodies that help to fight off the virus when our bodies come in contact with it. After a vaccine, a child has less of a chance of getting COVID. And if they do happen to get COVID, they will be not as sick as they would be if they didn't have the vaccine. How effective are these vaccines? All the research around the COVID vaccines has showed us that they are very effective, 90% and higher at stopping people from getting COVID. More importantly, they help prevent serious illness, hospitalization, and death in those who do get infected with COVID. We aren't quite sure how long the immunity from the vaccine is going to last. People 18 and older are getting their boosters now. As time continues and more people get vaccinated across all age groups, we'll be able to know more about the immunity and how long it will last. How do we know that these vaccines are safe? They are incredibly safe. I would say they're probably one of the most researched vaccines in history. And the research has also shown us that as the safety of these, that just continues to prove that they're safer as time marches on here. The randomized control trials that were performed for each age group gave us a ton of data, and they're continued to be monitored very closely. For example, when you get your vaccine, you can sign up to participate in the CDC tracking program that tracks you for months after you get your COVID vaccine, asking you any symptoms, what's going on. And if there's some things that pop up, you might have someone from the CDC contact you about something that's going on. So we're very excited that we get to have this close monitoring of the vaccines even years after they first came out. So how did the Pfizer vaccine come into our lives? In December 2020, we had the emergency use authorization for those 16 and older. In May of this year, that was extended to 12 to 15-year-olds, and CDC recommended for use. And then August, the FDA gave full approval for 16 and older, very exciting. And then just last month, the emergency use authorization for the 5 to 11-year-olds for the pediatric dose and the CDC recommendation for use came into play, which is probably I feel like we've been waiting a long time for these 5 to 11-year-olds to get this vaccine. So it's a really exciting moment for that to happen. Over 100 million people in the United States alone have been fully vaccinated with the Pfizer vaccine to date. And 15.5 million kiddos aged 12 to 17 have been fully vaccinated. And as of the 30th of November, over 4 million children ages 5 to 11 have received at least one dose of the pediatric vaccine. So why do we keep calling it the pediatric Pfizer vaccine and not just the COVID vaccine? It is a smaller dose for kiddos, for the 5 to 11-year-olds. It is 10 micrograms as opposed to the 30 micrograms that the 12 and older are getting. This is because kids have a more robust immune response to a smaller dose. So they are having the same immune response with a smaller dose as opposed to everyone aged 12 and older. The data that was collected in the kids that were getting involved in the trial, the 5 to 11-year-olds, is almost 91% affected against COVID. And this data was collected during our biggest case numbers of the Delta variant. And no serious adverse events have been related to the vaccine. So here is kind of the case study, how things came on. So it's an ongoing phase 1, 2, and 3 randomized, observer-blinded, placebo-controlled immunogenicity, efficacy, and safety study. Let me break that down for you a little bit. So what that means is that there are people that in this study that have gotten the vaccine and people that have gotten a placebo. In the first phase, they tested kiddos 5 to 11 years old with 3 different doses, 10, 20, and 30 micrograms. They decided in the next phase that the 10 microgram dose was where they were seeing the best immune response. So that was considered continued for phases 2 and 3 of the study. Then they were randomized 2 to 1, which means that the ratios, for every 2 kiddos that got the vaccine, 1 got a placebo. And they got the 2 doses 21 days apart, just like adults. And so what happened is that they tracked their symptoms, before and after getting the vaccine. They checked any side effects and if they had come into contact with COVID or not. And so what it showed us was that the vaccine was 91% effective at preventing COVID from happening, which is amazing. What about side effects? Some people have no side effects whatsoever, just like some people get the flu vaccine and feel totally fine otherwise, or some people will get the flu vaccine and they'll feel kind of achy for a day or 2 afterwards. In the 5 to 11-year-olds, the most common side effects include that localized pain at the injection site with some redness and some swelling. We're seeing those systemic symptoms like the fatigue and fever, headache are occurring at much lower rates in this age group as compared to the adult age groups and the older age groups. These side effects are temporary and go away within a few days and can be treated with rest and fluids, and if needed, some Tylenol or some ibuprofen, or even an ice pack at the injection site. So this is showing us data on the local reactions by what the biggest severity was, the biggest reaction was within 7 days after each dose in the 5 to 11-year-olds and 16 to 25-year-olds. So we can see that the pain in the injection site with the 10 microgram and a 30 microgram dose was the biggest reaction for kids. And with the placebo, of course, they had pain with that too, because it was still an injection. Redness and swelling are coming in a close second. And then with dose 2, that, the redness and swelling still coming in a little bit less. And then we're still seeing that pain in the injection site being the most severe response after the immunization. And now we have the systemic effects. So that fever, fatigue, headache, chills, vomiting, diarrhea, muscle pain, and joint pain. So, and this is again looking at those after the second dose in the 5 to 11-year-olds and the 16 to 25-year-olds. So that fatigue and the headache tended to be the biggest systemic response in both age groups. And then fever and chills were a lesser response, more so again in the older people than in the younger kids. Same with the muscle pain and joint pain. Vomiting and diarrhea, pretty rare. And then the placebo, of course, we had the kind of, fatigue and headache after the saline injection, but no other real big side effects with that one as expected. So we have a couple questions about vaccine-associated myocarditis. So there were absolutely 0 cases of myocarditis in the 3,005 to 11-year-olds who received the vaccine in the trial, which is amazing. We do know that there's an increased risk of myocarditis in the 12 to 17-year-old males after the second dose of the Pfizer vaccine, but it is still extremely rare. Even in the group most affected, the 16 to 17-year-old males, the rate of the myocarditis is 0.01%. So the benefits of this vaccine far outweigh the risks of these very rare things happening. So now we're going to look at myocarditis from COVID versus vaccine-associated myocarditis. So COVID-19 can cause myocarditis in children, and a child is actually more likely to get myocarditis from COVID itself than from the vaccine. And vaccine-associated myocarditis is more mild than the cases that are caused by a COVID infection. When we weigh the risks and the benefits, the vaccine is more likely to prevent myocarditis than it is to actually cause it to happen. And what about late onset side effects? In learning about the COVID vaccine and vaccines in general lately, one of the greatest things I think I've learned is that with any new vaccine, not just a COVID vaccine, but any new vaccine ever, there have been no new side effects ever documented after 8 weeks. We're almost 2 years into these COVID vaccines. So we would see weird, serious side effects at this point in time. We get a lot of questions about is this going to change my DNA? How does this affect, my ability to get pregnant in the future? Or if I am pregnant, how does it affect my baby? There is no way that the mRNA can change anybody's DNA or cause any fertility issues or cause issues with a fetus, a woman that is pregnant with her baby. mRNA is gone from our system within a few days, and it just helps our body to remember to build those proteins, those antibodies to help fight off COVID. And so what are the risks of the COVID-19 infection in this age group? Well, so here's our national data. So there have been about 8,300 hospitalizations as of early October in 2021, and approximately a third of the hospitalized children in this age group require an ICU admission. Here are our deaths from January of last year through October of this year. And in the children that are 5 to 11 years old, this group that's getting vaccinated right now, there's, it's about 1.7% death rate, which is still, you might say, oh, 1.7%, that's not much. That's still more children that need to die from this vaccine that can help prevent death from happening. Here's our Vermont cases right now. As you can see, that 5 to 11 age group still tends to be the highest case rates right now and has been since earlier this fall. And this data was as of December 4th, so as of just this weekend is what we're seeing. And so, yes, there's still more adults than children getting infected, but we're seeing higher rates in kids than we have previously right now. And you can see that those kiddos age 6 to 11 are accounting for nearly all of the new cases in the pediatric age group lately. So here's how Vermont compares to other states. we're doing pretty good here. So this is the cases per 1,000 children across the United States. And Vermont is here in the overall lower rates of cases, which is really great. So we're doing a good job. We're getting our kids vaccinated, we're keeping them safe, and we're helping to, keep stopping the spread of COVID. And for kids aged 12 to 17 who have received at least one dose, we are the second highest state next to Massachusetts in terms of our vaccination rate, which is amazing at 83%. So it's really, really heartening to see these numbers and to see this great success that we've been having with the COVID vaccines thus far. So pediatric COVID pneumonia, this is something that can happen after when kids get COVID and they get pneumonia with it. It can lead to low levels of oxygen in the body that require hospitalization because they need oxygen supplementation because they aren't able to move enough oxygen through their body with their lungs being affected. It can also require support from machines like ventilators to help assist in breathing. Severe COVID cases among our adolescent population. And so we have had such high vaccination rates among our adolescents that we have been able to protect our youth from severe COVID cases as the cases rose to the Delta variant. We're not seeing those like big hospitalization rates and everything because our kids were protected. And the national data has shown that the unvaccinated adolescents are 10 times more likely to be hospitalized due to COVID than their vaccinated counterparts. So now onto multi-system inflammatory syndrome in children, or MISC. So the case definition, very briefly, requires laboratory evidence of inflammation, evidence of severe COVID illness requiring hospitalization, or 2 or more organ systems involved. Myocarditis, that heart muscle inflammation, may be present and may also be severe. And this can be a recurrent or a current COVID infection. In the United States, we've had 5,973 cases of this and 52 deaths from it. I think as of earlier this week or late last week, we've had 1 kiddo in Vermont that met the criteria for the MISC. And so here you can see it by the age group. And this age group that can currently get the vaccine is also the age group that can be most affected by MISC and the age group that is most susceptible to it. So for every million Pfizer vaccines given in kids aged 5 to 11, using the recent incidence rates in females, 57,000 cases can be prevented, and then same in males, just a slight less in males. 191 hospitalizations can be prevented in females, and 226 hospitalizations can be prevented in males. And across both genders, 130 MISC cases can be prevented. And for females, 60 ICU admissions can be prevented, and 72 ICU admissions can be prevented among males. So again, these benefits are huge with this vaccine. So looking at our risks and benefits for these kiddos in this 5 to 11-year-old age group. So here we see the benefits. It can prevent COVID cases. It can prevent COVID hospitalizations. It can prevent ICU stays, and it can prevent death. The risks of having getting the vaccine, you can have the excessive amount of myocarditis or pericarditis cases, and hospitalizations, ICU stays, and deaths. So here you get the vaccine, you can help prevent these things. Without the vaccine, these things can happen. So factors that are not considered within the risk-benefit analysis. The hospital stay for vaccine-associated myocarditis is shorter than for COVID infection, and vaccine-associated myocarditis is a more mild course than infection-induced myocarditis. Also, children that get the vaccine, they can get help prevent transmission of SARS-CoV-2. They can have that disruption in in-person learning due to illness or exposure, and then post-COVID conditions like long COVID. So when the FDA looked at, was this vaccine going to be beneficial, they were basing it on the amount of scientific evidence available, and do the benefits outweigh its risks for use in children 5 to 11 years old. So they were really, really looking at the risk-benefit analysis, just like we have been in the past few slides. So a big question is, why is this vaccine based on age and not on weight? Vaccine dosing is not based on weight because vaccines are not a medication. Vaccine presents information to the immune system to help prompt it what it would normally do and have a quicker response. Our younger children's immune systems are more primed and ready to, that's why we have childhood immunizations, because we know when kids get these immunizations at 2, 4, 6, 12, 15, 24 months, that their immune systems are primed and ready to build up that lifelong protection. And so our younger children's immune system is ready and able to respond in a really strong way. So that vaccine dose is based on that immune system maturity rather than on the weight of the child. So how about those kiddos under age 5? What are we doing for them? Clinical trials are going on right now for kiddos as young as 6 months old, and smaller doses are being tested in these younger children. And it's sounding like maybe late of this year, they might submit for the EUA for the 2 to 4 year olds. And so hopefully early next year, the 2 to 4 year olds be the next age group getting the vaccine. And what about getting this vaccine at the same time as other vaccines? Totally fine. It's great to make sure that everybody is up to date on all their vaccines. And we didn't see hardly any flu last year. We're definitely going to see some flu last year. We are seeing more non-COVID illness going around right now than we have in a really long time. So we're getting ready for flu season. So we know that kiddos need their flu shot too, and they can definitely get it at the same time as the COVID vaccine. Or if you want to wait in between, that's totally fine. So 2 weeks after getting your second dose of the mRNA vaccine, your body has built up an immunity that helps protect it against COVID and helps fight it off if you come into contact with it. The COVID vaccines are all free, whether or not you have health insurance. The health department has many, many vaccine sites, and the Vermont Department of Health had started offering the community vaccination sites for the children on 11/4. School located sites began on the 8th, and some pharmacies will also have the pediatric vaccine. Pediatric and family medicine clinics will receive the vaccine in mid-November, so we have that. And Vermont will be getting weekly shipments of vaccines, so supply is currently a little bit limited, and really trying to focus on the school clinics and the VDH clinics rather than the office-based clinics right now, but I think that's starting to shift as we're seeing a little bit more of a supply increase. So if you need to find a vaccine site right where you can be and what's easiest for you, you can go to healthvermont.gov/myvaccine, and parents and guardians can add their children as their dependents. You can schedule an appointment at a school clinic or another convenient community clinic, and you'll just have to provide consent, or you can register using the call center at the number below. You'll be asked to provide consent over the phone when you do that. Here are some great resources for families from the Vermont Department of Health, healthychildren.org from the American Academy of Pediatrics, not only COVID vaccine information, but tons of information about kiddos, their development, nutrition, anything you wanted to know. And then great information from the Centers for Disease Control as well. Excuse me. Here's a new page from the Vermont Department of Health, all about COVID vaccines for kiddos, question and answer sections, talking to kids about your vaccine, where to get vaccinated. So our kiddos are prepared. They're excited to see their friends again. They're excited to be able to stay in school if they have a contact. They are excited to get life back to normal. So they're ready for this vaccine. We can now start the question and answer portion of the evening.
Well, thank you so much, Monica. Packed a lot of information into those 24 minutes. So for those of you on the call, just go ahead and use the Q&A function. I'm not seeing any questions there quite yet, but I do have some that have come in. So Monica, why don't we start with, my kid will be 12 in January. Should I wait for the full size 12 plus dose rather than the 5 to 11?
That is a really great question. And I would say there is no need to wait. As we had mentioned in the presentation, the vaccine is based on immune response and not what your child's weight is. So even if they are 11 years and 364 days, I would say get the vaccine that day. They are going to have the appropriate immune response. And the risk of waiting and having that exposure is greater than getting the vaccine at the age appropriate dose. And we have plenty of kids that will be getting the dose, at that 11-year dose, and then a couple of weeks later when they get that second dose, getting the 12-year dose. And that's okay too, to have that kind of mixing and matching going on. Again, it's based on their immune response and not their weight.
Wonderful. Great answer. Here's another one. So my child is 5 and is premature and small for his age. I think you just answered this, but just to reiterate, what should a person do? Is the 5 to 11-year-old dose safe for a premature child who is small?
Yeah, so that's another great question, and kind of goes along with that previous answer. So yes, it is very safe. It is based on their age. It's not based on what we call their corrected gestational age or how old they would be, based on their due date versus their birth date. So whatever their birth date is, and no matter what their weight is, if they're small for their size, if they're young for their age, anything like that, as long as they're 5 to 11 years old, very safe for them to get the dose, the 10 microgram dose.
Great, thank you. Okay, these are all questions we hear all the time. My child has had COVID. Should they get vaccinated, and what is the best timing for that?
So absolutely, she should still get vaccinated. The data has shown that people who have had COVID actually have an increased immune response to the vaccine, which is great. Now, I'm not saying please don't go out and get COVID and then get your vaccine. Get your vaccine. Hopefully, don't get COVID in the meantime. So the recommendation is that you wait until quarantine is over and most of the illness symptoms had passed. We definitely can give kiddos immunizations, no matter what immunization is, if they have mild illness symptoms. But more severe or prolonged illness symptoms, we do say to wait, and definitely waiting until that quarantine period is over as well.
And that reminds me to say, thank you, Monica, that it's come up if your child is quarantining because they're a close contact. Actually, this is true of adults as well. The health department has decided that we are so eager to get everyone vaccinated that a person is able to leave quarantine briefly to receive the vaccine and return home. And that is pretty stated quite clearly on the health department website, but we do get asked that question a lot.
That's great.
Okay, Monica, so what happens if my child gets sick with COVID between the first and the second dose?
So that kind of goes back to, it all depends on where they are at. So are they, have they finished their quarantine by the time they're due for the second dose? Have most of their illness symptoms resolved, or did they get sick at day 20 when they were due to get the vaccine on day 21? So if they are not outside their quarantine, and if they have not majority recovered from their illness, then we would postpone the vaccine until they are able to, the quarantine is ended and illness symptoms have improved. It is okay to extend that second dose. Doesn't need to be repeated. The minimum time frame is that 21 days, but if it happens to be 28 or 32 or 42 days, that is okay.
Great. And people, I do want to make sure everyone knows that the answers are very clear to us after answering them for several weeks, but we know that each one of these scenarios sometimes need a double check. And for folks that find themselves in an interesting scenario, please either call the health department or your pediatrician, your medical home, the place where you receive health care, because it is very specific sometimes, and we want everyone to feel they're getting their questions answered. So, Monica, are there risks to children if they have antibody from infection and then get vaccinated, and can they develop any sort of an immune complex?
So I'm not quite sure about the immune complex part of that question. I might defer to you on that one, Brina, but I know that there's no risk to them if they have the COVID vaccine and then they get vaccinated, they get COVID and then they get vaccinated. They have a really strong immune response. So I'm going to let you cover the immune complex question, part of that question.
Yeah, I think this is one of those questions that comes up because people worry that the immune system has some sort of prolonged effect, and that then if you were to add a vaccine on top of the infection, it would complicate things, which is not the way our immune system works, in particular with the way we respond to viruses. So there would be, the natural immunity that comes, which we don't know how long that would last from the infection. And we're still recommending, as Monica said, that you go ahead and get the vaccine, because that's a much more understood immunity. And we know that we'll be tracking that, and we'll know whether or not you need a booster. And there is no long-term competition between the immune response from the virus and the immune response from the vaccine, because they're separate pathways. So let's talk, I feel like the slides address pretty well the vaccine concern, or people's wanting to talk about myocarditis. But the question that came in is, what about a heart murmur? And does that create any increased risk for myocarditis?
It does not create an increased risk of myocarditis. Same with if the child had congenital heart disease, you wouldn't be worried about that increased risk of myocarditis. So still very safe for that child to receive the immunization.
Great. I really like the way the slides addressed the myocarditis risk, and the way that we balance all of our pediatric health care with our children is understanding risk and putting it in the context of pandemic. Monica, do you recommend giving Tylenol before or after the vaccine, or would you recommend holding off?
I wouldn't recommend giving it before. Certainly if your child had some of those systemic responses afterward, like the headache or the body ache or the muscle ache, it's very safe to give them Tylenol or ibuprofen after the vaccine if it's seeming like they need it. And again, as Brina had mentioned a few moments ago, if you have questions about that, calling your child's healthcare provider before giving it, if you're wondering about it, would be a great thing to do as well.
Thank you. I love this question. What do you recommend for a child that gets nervous or scared before a shot?
I think validating their concerns, right? It's a very real concern. Shots are scary and they hurt. Please don't ever tell your child that it's not going to hurt, because they hurt. It hurts for a moment, but it's still a very real feeling of pain and a very real hurt. So say, yes, it is going to hurt. I know it is going to hurt for a moment. Ensuring them that you will be there with them throughout their vaccine, talking to them about what it means to get the vaccine, the protection that they're going to have from COVID, and what they will be able to do after getting the vaccine in terms of, seeing friends, or, being protected if there was a COVID case at school, they could stay in school with the test to stay programs. And also what it means in being able to prevent passing COVID to other people in the community or their families, for example. And also distraction is a great technique. We actually just got this great box of goodies from a program through the Vermont Children's Hospital where we have these great distractions. So if kids like touchy things, we have these squeezy balls, or we have this little thing that you press a button, these lights light up and spin around, or we have a sense that different scents that you can smell. And so depending on what your kiddo kind of likes and where they are at tactically or sensory wise, we can have that. And also giving kids a big bear hug when they get the vaccine. And this is a point in time too, where I am not above saying, if they want to scream, they need to watch something on YouTube or a funny video of themselves doing something, another great distraction for them.
Great. Part of the reason we end the slideshow with those photographs of those incredible children is just to remind ourselves that this is one of the fun, interesting parts of the pandemic, is how children, they've been listening, and their developmental capacity to understand what we're experiencing is actually pretty terrific. And all these family friends and our pediatric colleagues who have school-age children have fed back to us that the kids are ready and they want this, and they know that it will help their community, it will help themselves, and then they pose for photographs that really should be award-winning with those beautiful pictures. Okay, just a few more questions here. So if, we're hearing in the news there's all this breakthrough infection, so why even bother getting vaccinated?
That's a really great question. I agree, that's come up a lot in the media lately. So we get vaccinated to prevent that serious illness, to prevent death, to prevent hospitalization. So sure, you could get COVID and not be vaccinated. Your chance of having a more severe illness at that point in time and being hospitalized is much greater than if you were to have a breakthrough infection after having the vaccine. It's like getting the flu shot and you still get the flu. It's more like a cold instead of having a horrible flu.
Yeah, that's the other thing the infectious disease doctors talk to us about all the time is even with breakthrough infections, these are the most effective vaccines we've seen in our lifetime. So their expectation as experts going into the development of vaccine was that we would, 70% effective or 75% effective. And when the early data came in that they were 86, 88, 89% effective, that was the sign of just incredible success in the vaccine development. But that still means 10%, 11% of people who are vaccinated can contract the virus. So we have to put the effectiveness in the context of hospitalization and death, as Monica said, but also in the context of our long history of vaccines and their ability to produce immunity and protect from contracting all sorts of infectious diseases. These are going to come down in history as the best vaccines we've ever had. Okay, here's an age-old last few months. When will the vaccine be available for children under 5?
I'll give my snarky remark of sometime in 2022, but truly, I hopefully that the 2 to 4 year olds will be early 2022, and then the 6 month to 2 year olds would be, later in the year. But it all just kind of depends on how the trials are progressing. And from what I've read, they are progressing very well, which is exciting.
That's right. We've been heartened by the process and the all hands, the focus on the studies, the trials, and then the very thoughtful approval process to get them into our communities. So it definitely would be 2022, Monica. That's a good answer since we're on the brink of the end of the year. And then if these vaccines are effective, why do we need boosters so soon? And do you think that might be different for children?
So yeah, I think we need boosters so soon. Well, so we as mentioned during the presentation, we don't know how long the immune response is going to last for. And is this a lifetime protection? Is it 6 month protection? Is it 12 months? Is it 18 months? And so we're still trying to gather that data. I would not be surprised if, everyone ends up getting boosters, all age groups. What those look like, is it every year? Is it every 2 years? Is it a seasonal thing like the flu vaccine? I'm not sure. And maybe Brina, you have some better information on that.
No, I definitely don't. I just have also been so pleased with the way our scientific community is acknowledging what we know and what we don't know, and the decisions about when to boost have been made by large groups of people who are watching and studying it effectively. So not sure. I do think that, in general, like flu vaccine, these are coronavirus vaccines need boosting, and here we are. I think I'm going to make sure Stephanie has space in case a question has come in that's not visible to me or Monica. And I also want to give participants a chance if they want to put something in now. We have a few more minutes. Double check all my sources of communication, and I think we're good. I guess that we could just end with a little bit of a philosophic conversation because you've got your wonderful community nurse practitioner here. So those of us that practice pediatrics and that work in this space that we love of communicating and working with families, that how do you weigh risk and benefit for your patients and for your children when we're making these recommendations? So I guess, Monica, if take us to a private conversation you would have in the office setting when a family says, help me through this.
Yeah.
This is my beloved child. He's 5 years old. What should I do?
So I always start this conversation with, I would never recommend something to you that I would not recommend for my own family or my own child. So to kind of set up that kind of state, like you just said, bring that safe space, like there is never going to be a recommendation that I would not do for myself, for my family, for my own daughter, and say that it's okay for you to do it as well. Also, then looking at the data, this is it's 90.7% effective at preventing severe illness, hospitalization, and death, which is like a huge goal with any vaccine. The benefits to this are so much greater than the risks being the biggest one being pain and soreness, swelling, redness at the injection site, followed by some of those systemic responses of fatigue, fever, and headache, with all of these symptoms being much milder in kids than it is in our older age group. Lastly, it's getting kids back to their normal. It's having them stay in school without those disruptions for quarantine, for the runny nose that they are probably going to get at some point in time this year, because we are seeing all those non-COVID viruses coming around again. And it's also getting them back to be able to socialize with their friends more, which is really what kids want to do. And I think that's one of the biggest effects that we've seen this pandemic, is that kids and adolescents have not been able to interact with their peers in those meaningful ways that they have been previous to this. So it's not only helping them prevent illness, but it's getting their lives back to more of a normalcy.
I really love ending with that question, because with the leadership of Stephanie Winters and the great pediatric healthcare professionals in Vermont, we just really welcome the conversation. And it doesn't have to end tonight. It doesn't have to, be in this setting. If you want to make an appointment with your health professional, the person that's been with you since your child came onto the earth, or has been through middle of the night experiences or child development problems, concerns, I feel like that relationship is where you can really rest your mind and bring forth your concerns, what you're hearing, maybe from family, maybe from the media, and bring it into that trusted partnership between you, your child, and your healthcare professional. So I just really want to thank Monica for putting forth the effort tonight. So much great information. Please let us know if there are additional questions, and I think Stephanie will be all right with us wrapping a little early. We've come to the end of our list, and we're just appreciate all your time and appreciate the conversation. So let's keep talking. Thank you, Monica.
Thank you,
thank
Brina.
you, Crystal.
Thank you, everybody.
And Jordan and Stephanie. Great team tonight. Appreciate it.